Hello and welcome to GP Notebook TV. My name is Anish Kotecha and I'm a GP in South Wales. Today I thought I'd discuss with you the relatively recent MHRA guidance and advice that came out, talking to us a little bit about topical steroid withdrawal reactions, and this is relatively recent. It came out in September 2021. In essence, as usual, I'm going to give you some bullet points and take-home messages that I feel are important to us from this guidance. Now, as a bit of background, we all know how useful and highly effective topical corticosteroids can be for conditions such as eczema, psoriasis and atopic dermatitis. We use them all the time. We know that they come in certain potencies, so we can get mild, moderate, potent or very potent topical corticosteroids. And we should be using the lowest potency topical corticosteroid for the least amount of time possible to control the patient's symptoms and condition. It's very appropriate to allow people to retreat themselves as long as they know when and how to do that, and also when to come back to us for a medical opinion. Now, topical corticosteroid withdrawal reactions are a known phenomena, and they can occur after prolonged inappropriate use of topical corticosteroids, and usually when we're using the more moderate to high potency ones. They can occur in adults after a year of daily use, and in children sometimes as quick as 2 months of use. Now, people with atopic dermatitis are thought to be at the highest risk, and we should be on the lookout for these withdrawal reactions. And if people are on high dose or more potent corticosteroids, then we should be trying to reduce the potency and the frequency of use as well. And we should really be advising patients on how much to use and where to use them and where not to use them, which I'm sure we all do. Now, we should be thinking about topical corticosteroid withdrawal reactions if people complain of burning and stinging, and the redness can sometimes be quite confluent rather than patchy, and people often sort of say that their skin burns more than itches. The most common place to get it is around the face and the genitals, and sometimes if it's in places where it's unusual for them to get their skin condition, then we can think about whether we're looking at a topical steroid withdrawal reaction as well, and certainly if they've been using a steroid for a prolonged or an appropriate amount of time. Now, skin biopsies are not very helpful in diagnosing the skin condition, and sometimes when we're treating people, if their condition fails to settle, then sometimes rather than just increasing the potency of the steroid we're using, we should be thinking of alternative diagnoses, things like rosacea, peri-oral dermatitis, infections and allergies. And of course, if we're suspecting an allergic reaction or an adverse reaction to topical corticosteroids, we should be reporting this via the usual mechanism of the yellow card scheme, and telling patients of this. Now, following the MHRA guidance, we should be expecting the patient information leaflets to be updated on the risks and characteristics of topical corticosteroid withdrawal reactions. So, in summary, we know that use of topical corticosteroids is very helpful and they're highly effective for certain conditions, but we should be on the lookout for any evidence of withdrawal reactions, especially if people have been using them for a long amount of time, and then the more potent topical corticosteroids. So I hope you found this video useful, and do continue to tune in to GP Notebook TV for further videos. Thank you very much.